let's get started with the next topic, that is prostatitis. So prostatitis, it's a problem related to the prostate gland for the male reproductive system. Okay, prostate, which is a walnut-sized gland present in the men's, it is the inflammation of that prostate gland. Okay, prostate gland actually helps in the production of semen and nourishes it with the hormones and helps to transport the sperms into the circulation. Okay, so prostatitis is a painful, or you can say a problem where you may feel difficulty while urination. Okay, there may be problems related to it like groin problem or pain in pelvic area or pain in genitals and even sometimes flu-like symptoms. Okay, so prostatitis, they affect men of all the ages, but particularly it is happening in men with 50 or younger than 50. Okay, so the symptoms, if we talk about, then there may be dysuria, that is problem or pain during urination. Okay, then there may be nocturia, that is you may going for frequent urination but at the time of night. Okay, then you always have a in your mind that you need to go for urination, and when you are passing urination, your urine will be cloudy having blood in it, that is hematuria. Okay, there may be pain in the abdomen or groin area. Okay, then there may also be a pain in perineum area, that is scrotum and rectum area. Okay, there may be discomfort in your penis or testicles, and whenever you are ejaculating semen, you may feel pain in your penis. Okay, other is bacterial prostatitis, that is flu-like symptoms in bacterial conditions. So the causes, if we talk about, then the causes are that it is being affected by the bacteria. Okay, so in chronic bacterial prostatitis, antibiotics never going to eliminate the condition because it's a reversible, it's a reoccurring problem. Okay, so its nerve damage can be on the hand. If you are not treating it, your lower urinary tract nerves can be damaged by the prostatitis. Okay. Then the risk factors is it is more common in young pupils or middle-aged persons. Okay. Then if you are having prostatitis in previous years, then you may have this in coming years also if you are not treating yourself. Okay. If you have transported infection to the bladder, okay, or if you have some trauma to your pelvic area, like you have an accident, you have an injury, or when you are doing horseback riding. Okay, then if you are using catheter for a long time, or if you have HIV, or you have undergone a prostate biopsy. Okay, next is infertility. Okay, so infertility means when you are not fertile for the next offspring. Okay, or in simple word, if we say in ladies, when they are not getting pregnant for a year or more with unprotected sex, that is called infertility. Okay, and if we talk about males, then if you are not able to pregnant your wife, okay, then you are infertile. Okay, a combination of male and female infertility is about 30 to 40% in couples. Okay, but men's infertility is always undetermined. Okay, so the causes, if we talk about male infertility, they may be effective production of sperm. Your sperms are not properly making up. There may be some effect in them. There may be some problem in sperm count, or there may be some problem in the shape of the sperms, and there may be problem in the movement of sperms. That is, they are not properly moving ahead. Okay, risk factors is it is more common in persons having old age. Nowadays, if a person have crossed 40 years of age, okay, there will be less chances that he may have his hope springs. If a person is smoking cigarettes, then, or if a person is alcoholic abused, or if a person is overweight, and even if you are being exposed to toxins, pesticide, herbicides, or any heavy metals, that can also leads to infertility. So conditions that may cause male infertility is retrograde ejaculation. Properly ejaculation is not happening. Varicocele, that is the swelling of veins around the testicles because of which erection of penis is not happening, or testicles have descended into the scrotum, or having antibodies that attacking the sperm and destroy them before they can get into the stream, or hormonal imbalances. Now, if we talk about infertility for the females, the causes may be related to the ovulation. That is, when the eggs are matured, they are not released into the ovaries. Fertilization, like the eggs of the lady, they are not properly getting fertilized, or even if they are getting fertilized, they are not moving from the cervix to the uterus, or implantation. Okay, in which fertilized eggs, they attach them to the uterus where they grows and develop into a baby. Okay, that is not working properly. So risk factors, if we talk about in females, is again increasing age, because after 40, ladies, they get menopause. Okay, smoking cigarettes or drinking alcohol or having overweight, they all are same as the males. But if the ladies, they are having sexually transmitted infection that damages their reproductive system, that is also a risk factor for the infertility. So medical conditions that can affect female reproductive system into infertility are ovulation disorders, like we have discussed polycystic ovarian syndrome, or pelvic inflammatory disease, or endometriosis, the internal layer, absence of the internal layer, uterine fibroids, there may be cyst in the uterus, then ovarian failure, or scars due to some previous surgeries. So that is it for the reproductive system. We will meet again with the nervous system.